Good afternoon, everyone, and thank you for being here today. Ehlers-Danlos syndrome, or EDS, is a connective tissue disorder that affects the body's ability to provide stability to joints, ligaments, and the spine. In some patients, this can lead to cranial cervical instability, or CCI, a serious condition where instability at the base of the skull places pressure on the brainstem and spinal cord. The impact can be severe, leaving patients with chronic pain, neurological symptoms, and a significant loss of independence. I would like to introduce to you today Sydney and her father, Joe. Since October 2024, my office has worked with their family to try to access the care that Sydney needs. But like many others, they have encountered barrier after barrier. Sydney has been unable to secure appropriate treatment within Ontario and has been denied out-of-country care OHIP funding for a life-changing surgery in the United States. Like many EDS and CCI patients, she has exhausted every available option and has been left without the medical care she needs. You will also hear from Karen, whose daughter has been left in the same situation as Sydney, and many others like them here in Ontario. But there is hope. There are medical services that can make tremendous improvements to their conditions. And we have two examples here with us today. Aaron and Mara ultimately paid out of pocket to undergo surgery in the United States for their conditions. But their recoveries speak for themselves. This is what is possible if the government would open up the pathway for care for these patients. Our goal is simple. Patients like Sydney deserve access to the same life-changing care without detrimental financial barriers that are placed on people, and it's out of reach for most families. So again, I would like to thank all the guests here today, and I'm going to pass it over to Sydney and Joe. Thank you.
Thank you, Teresa. My name is Sydney Jeorgia. I'm 26 years old, and I'm here today not because I want to be, but because I have no other option left. For the past 2.5 years, I have been trying to access medically necessary neurosurgical care in Ontario. And I want to be very clear about something from the start. This is not a story about a rare condition. This is a story about a system that does not have a functional pathway to care, and what happens to patients when that pathway does not exist. Because when there is no pathway, patients don't just wait, they deteriorate. Over the last 2.5 years, I have done everything a patient is supposed to do. I have been referred over 10 times to neurosurgeons across the GTA and southwestern Ontario, and I've been rejected by every single one. I have filed multiple complaints through every oversight body available: the Ontario Ombudsman, the Patient Ombudsman, Hospital-Patient Relations, you name it. My MPP has written to the Ministry of Health trying to get answers, even just the names of the physicians who can treat me. I have also contacted the CPSO for guidance. I filed a Freedom of Information request, which was denied, and I am still fighting for that decision. I brought an application to the Human Rights Tribunal of Ontario, representing myself, until I physically and cognitively could not continue to. I have gone to the media, CBC News, radios, TVO's Mistreated podcast, because when a system doesn't respond to patients, patients start looking for anywhere that will listen to them. I have written a 50-page guide for patients wanting to apply for a case with the Human Rights Tribunal of Ontario, so that other patients don't have to start from zero like I did. And yes, I've even emailed neurosurgeons in the middle of the night, not even knowing if they treat my condition, but just asking if anyone could help me. This is what accessing healthcare in Ontario has required of me, and still, I do not have access to care. So the question becomes why? Because on paper, Ontario has a solution. The out-of-country program is supposed to ensure that when care cannot be provided here, patients can access it elsewhere. But in reality, that process is not accessible. It requires patients to obtain support from in-province specialists that, in practice, do not exist within Ontario with the expertise needed to assess and validate these cases and applications. So what we are left with is not a healthcare system failure in theory, but a structural failure in practice. A system that says care exists, a process that says apply, and requirements that make that application impossible. And the result is predictable. Patients are denied, applications are never submitted, and the system can point to low numbers as proof that the need is small. But the need is not small. It is just invisible. The process filters patients out before they ever have a chance to be counted. And I want to say this clearly. Patients are not failing this system. The system is failing these patients. Because it should not take 2.5 years of full-time effort, legal action, media advocacy, and complete personal exhaustion just to access medically necessary care. And I know that sometimes in rooms like this, it is easy to hear a story like mine and think of it as an exception. But I want you to pause for a moment and ask yourself, if this was your wife, your child, or somebody that you love, would you accept this process? Would you accept being told that care exists, but nobody can help you access it? Or would you expect a system that works? Because that is all we are asking for. We are not asking for something new. We are not asking for something experimental. We are asking for a functional, out-of-country pathway for patients to access care that already exists when it is not available in Ontario. This is fixable. The government has the authority to do this. The policy framework already exists. What is missing is a process that reflects that reality. Because right now, patients are doing everything right, and they are still being left behind. I'll leave you with this. I am standing here today because I fought very hard to still be here. But there are many patients across Ontario in the exact same position as I am who cannot stand here today. Not because they don't want to, but because they don't have the capacity left to fight. They are at home. They are deteriorating. Some are completely bedridden. And they are waiting for a system that does not reach them. Thank you.
My daughter, Sydney, has an easier path to death than to treatment in Ontario. My name is Joe Jeorgia, and I am here as Sydney's father. I am here because my daughter Sydney is running out of time, not because there is no treatment, but because she cannot access it. The issue is clear. Sydney was denied out-of-country care through the OHIP out-of-country funding process. A physician whose identity is being withheld from us has decided that she does not need surgery. For this condition that her treating doctors have fully documented and fully supported, and for which they have recommended surgery. We are not told who this physician is. We are not told their credentials. We are not told the science that they have relied on. A nameless, faceless person is overruling the doctors treating my daughter. A faceless decision maker is deciding whether my child lives or dies, while she suffers invisibly and unspeakably. As summer approaches, families plan vacations, barbecues, time with friends. My daughter Sydney will spend it in bed, looking out a window, wearing a neck brace, hoping somebody is close enough when she needs help just to go to the bathroom. She will watch as her life passes her by. Sydney is a young woman who loves life, and we are watching that life disappear. Not because nothing can be done, but because the system will not act. There is something even harder to say. We have a clear pathway for MAID, for medical assistance in dying, but we do not have a clear pathway to prevent it. We have made it easier to access death than to access treatment. As a father, my fear is this: my daughter, who desperately wants to live, may one day feel that she has no choice, not because she wants to die, but because we failed to help her live. This is not hypothetical. We know how this progresses. Unspeakable pain, suffering, isolation, loss of dignity, and ultimately a vegetative state and likely death. It will reach a point where death itself feels like relief. The treatment she needs is not experimental. It has been done successfully here in Ontario. The expertise existed 10 years ago. It has been done in Ontario. So we ask, on what basis is care denied? What science supports these decisions? Because without transparency, there is no accountability. Public money has been spent. Programs exist. Experts have provided their input. Yet places like the Good Hope Ehlers-Danlos Clinic admit surgical services are not being delivered. So we ask, why are patients being sent there? Where are the results? Let me bring you back to Sydney. At night, I sometimes see her when I say goodnight to her, quietly putting makeup on, in a small mirror, by a dim light. She's not doing this for others. She's doing it to hold on to who she was, her dignity, her identity, her humanity. Now, imagine saying goodbye to her. Imagine us as a family holding her hand one last time, looking into her eyes one last time. Saying goodbye to a child who desperately wanted to live. This is not a distant possibility. I fear a day when living within the walls of a 24-hour care facility becomes intolerable, and she may choose death. This is my worst fear, not because medicine failed, but because the system did. I believe in our leaders. I believe if they understand the problem, they will fix it. That is why we are here today. One day people will ask, who knew? Who could have acted? And why didn't they? This is not about blame. This is about action. Our request is simple: transparency and immediate access to the OHIP out-of-country care and long-term solutions. Our job as parents is to make it known that the OHIP out-of-country process does not work for patients with EDS and CCI. Right now, the system offers my daughter a clearer path to death than it does to treatment. That should never be true in Ontario for any family. To our elected officials, who I truly believe in, please hear us. Please act. Please fix this broken process. To the Honourable Sylvia Jones, our Honourable MPP Teresa Armstrong has asked you to meet with us. Honourable Minister Sylvia Jones, I am now asking you to meet with us. Meet with our family and meet with Sydney. Thank you.
Good afternoon. I'm Karen Powers from Aurora, Ontario, and I'm here today representing my daughter, Jeorgia, because she is too sick to be here herself, in the hopes that the government will listen and finally provide care for patients like her. Jeorgia has Ehlers-Danlos syndrome, and it has impacted her spine. She has craniocervical instability, or CCI. Jeorgia's neck isn't stable. When she moves her head or even shifts her body, she experiences a constellation of horrible and debilitating symptoms. She lives in constant pain. She requires urgent surgery to stabilize her spine. Jeorgia is 19 and has been completely bedridden for almost 3 years. Jeorgia's life can be measured by what has been taken from her. At 16 years old, she was in school with friends, plans, and independence. And then the day I won't ever forget, in grade 11, she called me from school in tears with severe head pain and a cluster of new symptoms. And that was the last day she was able to be upright. She never returned to school. That was May 1st, 2023. At 16 years old, Jeorgia had to leave her life behind because she can't sit or stand without severe pain. She's lost all of her independence, and her untreated conditions over 3 years have only worsened. She hasn't felt the sun on her face or a breeze on her skin in 3 years. Her friends are in their second year of university. But Jeorgia can't read, watch TV, or tolerate light or sound. She has no quality of life. Each year without care has narrowed her world further, from a full life to a single room to a single position in bed. This is what happens when treatment is delayed or denied. She is surviving, not living, but she's also fighting and not giving up, clinging to the hope that the care she needs will arrive. No parent should have to watch their child suffer and deteriorate like this, knowing that treatment exists but is out of reach. We paid for an assessment in the U.S. by a neurosurgeon who specializes in Ehlers-Danlos syndrome. She has a clear diagnosis, CCI, and a tethered spinal cord. This diagnosis is supported by imaging, but we have not been able to find a neurosurgeon in Ontario willing to assess or treat her. No one in Canada would even look at the upright MRI and measure it for themselves or assess it for themselves. She's been diagnosed in Ontario with a jugular compression caused by her vertebrae from the cervical instability. This obstructs outflow from her brain and causes her to have high intracranial pressure symptoms. This neurosurgeon who diagnosed this has no one to refer her to. She's also been diagnosed with spinal fluid leaks known to be caused by high pressure, but there's no one in Canada who will treat the underlying condition, so she has to live with all of this. We've taken her to 6 Ontario hospitals, both pediatric and adult, and each time we've wheeled her out of those hospitals in the same condition she arrived, bedridden, in extreme pain, and without care. She lies on hospital floors for appointments because she can't tolerate the pain of being upright, even for a few minutes. We've been told she's out of scope. We've been told by specialists they've never heard of her condition. Multiple times we've attempted to see a specialist for one of her conditions and have been told to take care of the other ones first. There is no one treating CCI for EDS patients in Canada, no one with the knowledge to evaluate her completely. There is no one who will take responsibility for her care. She is stuck in a loop. When medical care is not available in Canada, it's supposed to be available with the out-of-country care program. However, we can't apply for the out-of-country funding because of the structure of that system. When there's no physician treating a condition or accepting patients for the condition equal to the surgery that you need in the U.S., there is no way to meet the criteria to apply. This is another loop preventing access to medical care. Jeorgia is unable to access any health care she desperately needs. This is not acceptable. This didn't have to happen to my daughter. Surgical treatment hasn't been available in the U.S. for the entire time she's been sick. She could have had surgery in the beginning and continued her life. We have worked with our MPP, Michael Parsa, and multiple MPPs have raised this gap in care in legislature. I'm here today as part of the Advocacy Day at Queen's Park to speak about this gap. We're here today asking policymakers to act to create a pathway for neurosurgical access for patients with Ehlers-Danlos syndrome and to prevent other families from being left in the same position. It never had to be like this for Jeorgia, and it should not continue to be this way for others. A system change will not come soon enough for Jeorgia. She's getting worse, and she's getting weaker. She needs surgery, but the long delays have cost her and are going to make her recovery so much harder. Without surgery, she will continue to spend every minute bedridden, in pain, and continue to decline. She needs surgery soon before it no longer becomes a viable option for her. We have turned to a GoFundMe, but Jeorgia's health care should be taken care of by our healthcare system with predictability and reliability, not dependent on the charity of others. We currently have no other option. You'll be hearing next from 2 patients who were able to acquire their needed surgery in the U.S. and how they were able to recover and live their lives. This should be everybody's story. I'd like to introduce Erin.
My name is Erin Summers. I'm a patient from Toronto. I'm here today because I was living with craniocervical instability secondary to hypermobile Ehlers-Danlos syndrome, a connective tissue disorder that affects the stability of the joints throughout the body. Although I was born with this condition, it wasn't until university that my symptoms began to impact my life significantly. What followed was 6 years searching for answers, 6 years of worsening symptoms and debilitating illness. 6 years spent seeing more than 20 doctors and medical professionals without a diagnosis and without a path forward. During that time, my health declined to the point where I could no longer continue my education, I could not work, and I could barely leave my bed except to attend medical appointments. I lived with debilitating fatigue, constant nausea and vomiting that caused severe weight loss, episodes of fainting and near fainting, and an inability to function upright. I remember laying curled up in pain on an exam table just waiting for the doctor to come in when he finally noticed how hypermobile I was. That moment led to my diagnosis, but a diagnosis was only the beginning. Once Ehlers-Danlos syndrome was suspected, it quickly became clear that I was also dealing with serious neurological complications, and it became equally clear that the care I needed did not exist in Ontario. In 2013, I made the difficult decision to leave Ontario and travel to Maryland, where I was finally diagnosed with craniocervical instability and underwent my life-saving surgery. My husband and I relocated there for months so I could access the post-operative care that is still not available here at home. That surgery saved my life. Today, I am a mother of 2. I'm able to work. I'm able to participate fully in my community. I no longer rely on specialists, and I no longer take medication. Access to that care depended entirely on my ability to leave Ontario and pay for the treatment elsewhere. Without it, I would have remained bedridden. I would have not been able to work, continue my education, or build a family. My story is not only about the recovery, it's about the access. What we've heard here today is about the consequence when that access to care does not exist within our own healthcare system. Thank you.
Good afternoon. My name is Mara, and I'm a former craniocervical instability patient from Toronto. I'm here today because I was once in the same position as patients like Sydney and Jeorgia, and now I am not. Now I am empirical evidence. Sydney is the before, Jeorgia is the before, I am the after. This is the difference that neurosurgical care makes for EDS patients with severe craniocervical instability. I'm going to abbreviate that as CCI. There is no effective non-surgical intervention for patients like Sydney and Jeorgia, and like myself prior to treatment, who have severe structural instability at the craniocervical junction. Stabilization surgery is the only viable path to recovery, and as has been made clear today, the surgical care is not presently available in Ontario. As a result, Ontario's out-of-country coverage policy represents the only available mechanism through which patients like Sydney or Jeorgia can access treatment. Applications for out-of-country care are consistently being denied on the basis that surgery does not meet the threshold of medical necessity. This fails to reflect the evidence established by treating specialists, which clearly supports a finding of medical necessity. Craniocervical instability in patients with Ehlers-Danlos syndrome is increasingly well understood, actively treated at specialized centers internationally, and supported by established diagnostic protocols and a growing body of peer-reviewed evidence. Thousands of patients like me, and like Sydney, and like Jeorgia, have undergone craniocervical fusion with documented functional improvement, and I hope that seeing my post-operative well-being with your own eyes makes the necessity of neurosurgical care less abstract. Before I got sick, I was a healthy, independent person. In my early 20s, I never expected I was about to be bedridden for 18 to 20 hours a day. My symptoms began in 2014 when I was 25 years old. I developed increasingly severe neurological dysfunction, mainly affecting my autonomic or automatic bodily functions. This is digestion, heart rate, blood pressure, breathing, eye function, and this all led to functional and cognitive decline. I actively sought care within Ontario's healthcare system for 6 years and was assessed by more than 15 specialists across multiple disciplines, including at the Good Hope Ehlers-Danlos Syndrome Clinic at Toronto General Hospital. Despite this committed level of engagement, I did not receive an accurate diagnosis, and my health continued to decline. By the time I finally received an accurate diagnosis in 2020, it was not in Ontario, it was in the United States, and by then I was unable to work, live independently, or be upright for more than 1 hour at a time. My condition was deteriorating, and delaying treatment meant risking permanent neurological damage, so I was left with a quote-unquote choice: continue to deteriorate or pay for surgery myself. These are bad memories. As there is no effective non-surgical intervention for patients with severe structural instability at the craniocervical junction, corrective surgery was the only viable path to recovery, and I self-funded my surgery. For most patients, this is not an option. I underwent craniocervical fusion surgery to decompress my brainstem and spinal cord, which restored neurological function. Today, at age 37, I work full-time, I live independently with my husband and dog, and we are planning for a future and to start a family. Without neurosurgical care, I would in all likelihood have sustained permanent disability and would be reliant on full-time assistance from a caregiver to function. The outcomes of surgical intervention are clear and documented. Individuals who were unable to work, drive, or live independently regain the ability to do so through neurosurgical care, like myself, and I hope that I can attest to the efficacy and the immediate need of this in Sydney and to Jeorgia. We understand. Thank you. Thank you.
We thank everyone for who was tuning in, and I have to say it's very disappointing that the media hasn't come today, because this is a very important issue that has to get out into the media, get attention, so that we can pressure this government to do the right thing and allow people to have access to a pathway for neurological surgery in out-of-country care. As you heard, Mara and Aaron's experiences, it can work. But Ontario does not have a neurosurgical pathway for CCI and EDS. I just want to thank everyone again for tuning in. I want to thank Sydney, Joe, and Karen, Aaron, and Mara for bringing this issue to light. And we will continue to push for it so that this government will make changes to out-of-country care. Thank you.